everybody, Dr. Carolyn Ross here again, and I just want to also share a resilience meditation with you. As I always recommend, sit in a place where you won't be disturbed. Take some deep breaths. Make sure your feet are flat on the floor. Close your eyes if you're comfortable, and if not, just stare at a point across the room. Now think of the situation that you want to resolve, something that has happened recently, or it could be an old situation that still has a lot of emotional content. Now allow that situation, pictures of it, thoughts about it, emotions related to it, to arise in your mind as if you're experiencing it now. Put yourself back in the place where that happened. Notice who's around you. Notice the surroundings. Were you in office? Were you at home? Etc. And just look around and see what you can see and hear. Now tune in to how you're feeling in this moment. Notice whether any uncomfortable emotions have shown up in response to imagining this triggering situation. See if you can notice and allow the emotions to be there without reacting to it. In other words, see if you can be curious about it, if you can welcome the emotion in rather than pushing it away. Whatever the feeling is in your body, allow yourself to sit with it. Be curious about the feeling rather than resist it. Lean into it rather than away from it. Now, as you sit with the feeling, let's think about the automatic negative thought that shows up for you in this situation. It may be the same negative thought that you used in the situation in the exercise. Notice what happens to the feeling in your body when you have that automatic negative thought. Notice whether it changes at all, perhaps becoming stronger or more intense. Now let us bring your coping thought to mind to replace this unhelpful negative thought. Use the coping thought that you developed in the resilience exercise. Allow yourself to repeat this coping thought to yourself several times over the next little bit. As you do this, notice what happens to the feeling in your body. Notice whether anything changes. Okay, take a deep breath in through your nose and out through your mouth. And as you do, slowly open your eyes and come back to the room where you're sitting. Just reflect on what it was like to sit with the feeling of distress. Ask yourself, what was the effect of the automatic negative thought on the feeling? Compare that to what was the effect of the coping thought on the feeling. I would strongly encourage you to journal about your experience, to write down your automatic negative thoughts, and to write a countering coping thought next to it. In this way, you can practice this skill of resilience in the face of any workplace situations that trigger your trauma, essentially. I hope that was helpful. This is Dr. Carolyn. I'll see you next week.